In 1980, we came up, we were in our early 20s, and bought a farm up here. And I do a lot of some carpentry work, sheetrock work, handyman type stuff, work on machinery for people. And we feed cattle. Um, we grow some of our own food and our own beef, and we sell some beef. And everything else we can afford. We, we don't buy a lot of stuff. Generally, mechanical work on the car and stuff I can handle. I've never been to a mechanic. A lot of people don't have that, so we don't really need a lot of money. But one thing we can't give ourselves is health care. And we were accepted for MaineCare with the expanded MaineCare about maybe 4 or 5 years ago. And I really was opposed to using it at first, but Paula had a heart attack, so she was only 52 or so, and it was no option not to use it. And her heart attack was fairly subtle. She said she didn't feel well. She didn't feel well, and so I said, well, we'll give it another hour. And she said, no, there's something wrong. So we went right down to Augusta, and if we didn't have MaineCare, I don't know if we would have gone, as soon. I've had arthritis for 40 years, since I was 18, and finally I was at the point where I could hardly walk by noontime. So I went to the doctor at the health center, and she set me up an appointment. I wouldn't be walking now if I hadn't gotten that operation. And now I can walk in the woods. I can do most of my work I can do. It's great. But a lot of people aren't going to have that opportunity. And every time you go to the store or go to town, you see somebody that's limping, or that's hurting and pain, and they're in need of health care. So I had that opportunity. I'm not going to have it now because we're going to lose MaineCare December 31st, and so I'm glad I got that done. And but I feel for the people that are not going to have that opportunity.